Hello and welcome to everybody's new Canton Potsdam Hospital. My name is Imre Rainey-Spence. I am a physician at Canton Potsdam Hospital, director of the hospitalist service and medical director of the ICU. It's taken a lot of energy, resources, and time to create this, but we brought you the most modern technology and healthcare system. We begin by showing you an example of one of these rooms. This is a room that is specifically created for patients of size. It is created to create the most comfort and safety for both patient and all of the staff at the hospital. You'll notice up on the ceiling that there's a Hoyer lift, which is built into the building. This Hoyer lift takes our patients directly from the beds right over to the bathrooms and safely lets them use the shower in the bathroom. Apart from this, we also have the newest and most modern precautions rooms. These precautions rooms are created to protect everybody who is outside of that patient's room from any contagious illnesses. So all of the rooms on the second floor can be converted to negative pressure rooms, which means that none of the contaminated air that's in those rooms will actually leak out into the hallways or make anyone else sick. We also have this new program called Intermediate Level of Care. Intermediate level of care is for patients who are too sick to be on the regular medical floor, but not sick enough to be in the ICU. This is a new service that we're offering thanks to this building and the technology built into it. So there are 6 beds on each of the floors can be converted to intermediate level of care, but if they're not needed as intermediate level of care, there are more beds available for our regular patients on the floors. This has increased our capacity for critical care patients from a total of 6 to 18. So each of the new floors is built with 30 new private rooms. Each one of those rooms will have one patient and one patient only. The beds are brand new beds. They immediately connect with our electronic medical record system. They tell us if a patient is in bed and comfortable or if the patient is at risk of falling or getting out of bed. They also help with the vitals. They are connected directly to the medical record system and they give that information to the system so we don't have to seek it. We have also upgraded all of our vitals monitor system. They are a new system for GE. They are for patients who are a little on the sicker side. They connect also immediately to the electronic medical record, but they allow us to monitor patients everywhere in this hospital wirelessly, which we were not capable of doing before. Each of the rooms has a vitals system in it. It's called a Massimo. This machinery is wirelessly connected to the patient. It monitors all of your vital signs, which is your heart rate, your blood pressure, your oxygen, and it lets everybody in the building know what's going on with you at all times health-wise without having you tethered to the room or to the bed by wires. Each one of the rooms has a private bathroom with a private shower, and each one of the rooms is also created to be able to bring your family into the hospital with you. All of the rooms are much larger. They all have a sofa bed in them. And for patients who are very sick or patients who need a little bit of extra TLC, we're able to host your families through the night should that be necessary. As part of the opening of the new building, we have a brand new and revamped emergency room. If you have been in our emergency room, you will have noticed it is much, much larger. We also have specialty rooms to be able to directly meet the needs of pregnant mothers, patients who are going through some kind of emotional or behavioral concern, as well as trauma bays that are much larger than the ones we had before and more accommodating to be able to meet our demands as a level 3 trauma center in the area. Our 4th floor remains unfinished at this time, but we have exciting plans for an expanded modern maternity suite, and it will include 2 dedicated operating rooms with adjacent pre- and post-surgery rooms, 9 private labor and delivery rooms, 3 private postpartum rooms, 4 triage and exam rooms. And the whole maternity suite will be built with a central nurses station and a secondary station on opposing corners for enhanced visibility of patient rooms. In constructing this new building, we also met with the patient and family relations committees and created an environment that is open to healing, that is inclusive of family members, and hopefully will be able to bring in the newest and greatest technology with new specialty services and new clinical services that we never imagined possible in the area. This is all because of the technology that's in this building and our partnership with Rochester Regional Health.